Today, an interview in action from the ViVE event down here in Miami. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. We want to thank our show sponsors who are investing in developing the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. And now, on to our interview. All right, here we are at ViVE 2022, and we have a special guest with us today, Snezana, man, with Transcarent, Chief Operating Officer for Transcarent. A lot of really exciting stuff going on right now at Transcarent. I'm looking forward to this conversation. We've talked to Glenn a couple times. I'm looking forward to
Great.
Not talking about strategy so much as just you're at the brass tacks of making things happen.
Absolutely,
So,
absolutely.
What's your background? How did you get to Transcarent?
So I'm a pharmacist by training, and I spent about 7 years with Walgreens, and then about 14 years with Express Scripts, and about 5 months ago I joined Transcarent, where Glenn convinced me to leave the big PBM world and try to transform healthcare at Transcarent. So
with all the stuff you know about the
with
PBM world.
all of the stuff I know about the payer in the PBM world, yes.
Express Scripts, were you in St. Louis?
I am based in St. Louis, still in St. Louis, and was in St. Louis the entire time while with Express Scripts. Yeah.
Well, we'll have to talk about that after the interview, because I lived there for 20 years.
Oh my goodness.
And people are complaining about the humidity down here, but the most humid place I've ever lived is St. Louis.
It's St. Louis. We do have a lot of humidity there, yes.
So some really exciting stuff coming out of Transcarent. I don't know where I want to start. I don't know if I want to talk about, the insulin thing with Civica is really exciting. What do you want to talk about?
Yeah, let's start with the insulin thing. We at Transcarent are ultimately focused on delivering very comprehensive, complete care experiences for the consumer, and also super focused on the affordability and sustainability of the benefit for our employers. So when you think about the Civica news and our partnership with Civica to bring more affordable medications to the consumer, 8 million Americans are dependent on insulin. And prior to the Civica news, the average consumer was spending over $150 on their insulin vials, and now we're able to bring that to members at less than $30 a vial. That is huge. So both from a consumer standpoint and the employer standpoint, this is good news, and we're going to continue to see opportunities like this in the future.
That in and of itself is amazing. The number of people that suffer from diabetes and need that medication. But that deal, is that more, that's about a broader set of medications as well, isn't it?
Correct. So right now Civica offers a lot of generic products that are available, and insulin was the next foray into trying to help a greater consumer set, both in terms of consumers that don't have any insurance, consumers that have insurance through their employers or health plans, and we're probably going to see a whole lot more from companies like Civica that are delivering some of those lower cost medications to the consumer directly.
So it's interesting.
Yes.
I just had a conversation last week, and I interviewed Mark Cuban. It's the Mark Cuban drug, Cost Plus Drug Company.
Yes.
And this seems to be an area, the PBM space seems to be an area where people are looking at it going, there's too many middlemen, there's too many components pulling money out of there, and it's not serving the employers real well. It's not serving the patients and the consumers, obviously, when we have the costs leading to what they are, and then we have bankruptcies as a result of costs of medications. So, you're somebody who really understands the PBM space. What's it going to take to transform this area?
Yeah, I think there's a couple of things we have to do. The first is bringing transparency to the consumer. Today, we will never be able to move into a true value-based care ecosystem without having a baseline of transparency. And unfortunately, the pharmacy space is one that's very opaque, and there's very little cost transparency, both to the employer and the consumer, most important. So the first step is giving the consumer the ability to see lower cost alternatives and to know that you can get this medication at this particular location just by simply switching a drug or switching where you get your drug. It's a huge opportunity. So companies like the Cost Plus opportunities, Walmart, Amazon, that are giving members a lot of those lower cost alternatives are certainly transforming that. Second is bringing transparency to the employers, and that's why you're starting to see a shift in a lot of the transparent PBMs that are emerging in the marketplace, where rebates are fully passed through. You're only paying for the services that are being delivered. And so we're starting to see a huge shift in the way care is being delivered in the pharmacy space, both from a cost and a care standpoint. And we're probably going to see a whole lot more innovation in that space as well.
So Civica Walmart. We talked to Glenn about the Walmart
Yeah,
deal.
yeah.
Are there others that have been signed? I know there's others in the works, I'm sure.
Absolutely. So Transcarent has been working with a lot of health systems. You may have seen some of our recent partnerships with Rush Health System in Chicago.
Right.
We are very much looking to transform the way their care is being delivered to their employees within the Rush Health System, and we're super excited about delivering consumer-centric experiences that are personalized, that are seamless, and that are longitudinal, while ultimately giving the consumer the ultimate upper hand and giving them the ability to get the care on their terms at the right time, right place, within seconds, day or night. And so we're really excited about that partnership.
That might seem counterintuitive to some people. They
Yeah.
might sit there and go,
Yeah.
a health system has to go to Transcarent for that experience. But having been at a health system that doesn't exist anymore,
Yeah.
we merged with
Yeah.
another one, so I
Yeah.
could talk about
Yeah.
this.
Yeah.
Our employees weren't happy with our how we handled healthcare, even though we were a significant healthcare organization.
Yeah.
They trusted the doctors, they appreciated their primary care physician, but the overall knitting it all together, the transparency like you're talking about, and they would still end up with these bills,
Yes.
and they'd be like,
Yes.
is this really what we're doing to our patients? And the
Yeah.
answer was,
Yes.
yeah, it
yes,
is what
that's
we're doing.
exactly what we're doing. So think about it. 1 in 3 Americans are skipping care because they're afraid of the medical bills. More
Right.
consumers are afraid of the medical bills than they are of the actual disease that they have been diagnosed with, which is a problem. 18 million Americans can't afford at least one or more of their chronic medications, and the experience is broken. It's totally fragmented. You have the medical benefits, the pharmacy benefits, the behavioral benefits, all of these point solutions that have emerged in the marketplace. Consumers are confused, they're lost, and they're spending over 50% of their time trying to understand where to get the care, how to get the right care. And so why these health systems are coming to Transcarent is they want to enable their consumers to be more productive. Think about it, less absenteeism, presenteeism, being able to be on their job, especially with the shortages of the healthcare workers that we're seeing. And so how do we enable their healthcare workers to be as present, as available for their work, their organizations, as well as their families, and giving them this amazing comprehensive longitudinal care experience that they have not had yet. And when we talk to some of our members, actually Rush members too, they tell us, I didn't even realize this type of a healthcare experience even existed before. And so it's awesome.
Well, when we were talking to Glenn, he was
Yeah.
talking about, we're committed to getting somebody on the phone within 60 seconds. And I'm like, okay, well, that's a big win right there. I mean,
Absolutely.
it's, somebody on the other
Yeah.
line to say, look, I'm trying to figure
Yeah.
out this or that,
Yeah.
and they walk you through it. It's pretty amazing. So Rush, that's the recent news.
Yeah,
Are there
yeah.
other health systems that have?
Absolutely. We're working with dozens of health systems right now, evaluating when they want to go live, and most of them will be going live later at the end of Q1 and early Q2. So more news to come.
So
Yeah.
that's health systems as clients.
As clients.
But then you have health systems you're partnering with.
Yes.
On the delivery side.
On the
as
direct
well.
care delivery side.
So what does that look like?
Yeah, so when you think about today, you have a lot of the virtual health, digital health companies out there that most consumers are interested in. But what we're finding is consumers actually want a hybrid experience. They want both local care and virtual care. And so what Transcarent is doing is we're bridging that integration of local and virtual in a fully coordinated mechanism. So when we partner with our health system partners, how do I offer telehealth capabilities at a local primary care provider, just like I may be able to give them a 60-second wait opportunity at 2 a.m. in the morning in a digital virtual experience, and having those two experiences speaking to one another and connecting is what we're developing. So giving that consumer choice. You can get your care delivered in a local setting, or you can get your care delivered in a virtual world from an acute care setting, and it's your choice, and that is where we're bringing local and virtual care in a fully integrated system.
What about specialty care?
Yeah, so specialty care, we're extremely focused on that as well, all the way from everyday care to complex care. So when you think about cancer care, MSK care, surgery care, behavioral care, we are operating in all of those segments, and we'll continue to expand in those categories over the next 12 months, where we will be able to service our clients with over 90% of total healthcare spending.
I would imagine, this is just me, but I would imagine that if you go in and talk to an employer right now and say, hey, here's what we have to offer, you're going to have to hold Glenn back from selling too much. There's an awful lot of demand for this.
There's an awful lot of demand out there, absolutely. And most of our employers that we speak with, they're exactly stating that. They're overwhelmed with managing the administrative burden of the various disparate point solutions that are in the marketplace. They're not getting the financial benefit, the ROI on the solutions that they've bought to date, nor are their members necessarily getting better, higher quality or the clinical outcomes. And that's exactly what we're doing. And the most innovative thing about Transcarent is we go fully at risk. So unlike many of the other solutions in the marketplace, we're full risk, we don't make any money until we save our clients money, and that's ultimately why they're so interested in us.
Yeah, that's fantastic. Those challenges, some of those difficulties, or what does that look like for you?
Absolutely, right. I mean, when I think back to 15 years ago when I entered the pharmacy PBM space, prior to that point, we were taught two things in pharmacy school. You can work behind a counter at a retail pharmacy, or you can work in a hospital basement pharmacy. There was not much out there about here's who you can do managed care. You can go into pharmacy benefits management, pharmaceutical management. So entering the business side of pharmacy was challenging because there's not a lot of women in that space. And I fortunately had the opportunity who had a lot of mentors and sponsorship in the organization that allowed me and gave me the opportunities to progress. And I've now made it a personal mission of mine to allow other young pharmacists who are in the healthcare space to see the world, to get some of these experiences, and to be able to make an impact.
So as a COO, you're negotiating these deals.
Oh, absolutely. Yes.
So
yes.
How did you go from where you were at to there? I mean, that's a different skill set, isn't it?
For me, fortunately, I also had the opportunities to gain some of that experience at Express Scripts by working with some of the largest health plans, employers in the country, negotiating deals, working with them in terms of finalist meetings, presentations, and actually one of the mechanisms how I met Glenn about 6 years ago, where Glenn was running Livongo.
You got to negotiate with Glenn.
I got to negotiate with Glenn. Yes, I was his toughest negotiator. He didn't like it most days, and he actually said to me about 4 years ago, he said, one of these days, if I ever build another company, you're going to be working on my side of the table, because I don't know that I can handle you again in my next adventure. So anyway, that's how Glenn called me last year and said, hey, look, I need you. We're building this incredible company, and I would love to have you build something incredible and transform healthcare. So
it is incredible. Hey, I want to thank you for your time.
Pleasure. Thank you so much for your time. I appreciate it.
Thank you.